Hello once again, and let's talk about medicine part 2. And in Russia, we have free mandatory health insurance, and a person can visit different city polyclinics, and just for adults, or just there are polyclinics for adults or children, and there are many specialized hospitals in Russia for the treatment of particular diseases such as cancer or infections, or just many others, and but nowadays, during COVID-19 times, it's too difficult to make an appointment to a doctor. If you have, for example, a pain in your stomach, or have a rush, or just, but if you don't have a high temperature, and I hope you will manage to find you will manage to see a doctor, to find a doctor to see. Now, during just these pandemic times, people have problems with their breathing, have a sore throat, sometimes a runny nose, and they lost smell abilities, and just if you have high temperature for several, if a person has temperature for several days, his lungs need to be checked at hospital, of course, and then a person should have an X-ray exam, and then if his or her lungs damage, he will be hospitalized, and if person there just a person will be given injections, will lose weight, unfortunately will have several checkups during this period, and stay there just for 2 weeks approximately, or maybe longer, and then be discharged from the hospital. If you have bleeding, or just maybe you have an awful food poisoning, you should immediately call an ambulance, and just in Russia you need to phone 112 from any phone that you have, and in Russia emergency ambulance service works day and night, and is free of charge, and I'm a really lucky person. I work in a Germany company and have a full insurance, and previously I worked at a Finnish company, and also had full insurance, and I don't know, just more than 10 years I go only to those hospitals and polyclinics which just they are not ordinary polyclinics, and they can give you all the necessary treatment, and I'm really lucky person. Thank you. Take care.